Chapter 33, Delivering Dental Care. Business assistant, clinical assistant, dental hygienist, and dentist must follow a specific routine. They need to review the patient record, have knowledge of upcoming procedures, have supplies and equipment ready. So it's always good to look at the schedule either the day before or a few minutes before the first patient, so you can know kind of what your day is going to be looking like and you can be prepared. Know your patients. One of the best ways to know your patients and to be better prepared for the day is to have a brief meeting or review of the day before your patients arrive. And this is what I was talking about the other day about the morning huddles. Some offices have that, and what they do is like 10 to 15 minutes before the first patient shows up, everybody in the office has a team huddle, like a small meeting, and they discuss what the objectives are for the day, what their goals are for the day, what's going to be going on in the day, if there's going to be a special meeting, a special blockout time, if a special patient is coming in, etc. So this to discuss the change in schedule or procedure, change in the patient's health that could alter dental treatment, additional supplies or equipment that may be needed, preparation for the apprehensive patient, and assignment of expanded functions. Reviewing the patient record. Several sections of a patient record are reviewed at each patient's visit. The administrative staff, they check for changes in personal information such as address or phone number and change. This is why every time you go into the doctor's office, whether it's the dentist or your regular medical office, they always on the sign-in sheet, it'll say, is there a change of address or phone number or insurance, etc. So the administrative staff will take care of that. Now the clinical staff, they'll check for health problems that may alter the dental treatment, look for medical alerts, and review progress notes for the planned treatment for the day. So clinical staff will look to see if the patient needed to be pre-medicated before any type of procedure, what kind of medication they're taking, if it's going to have like a side effect with the procedure that's going to be going on that day, etc. Preparing the treatment area. So the treatment room clean, disinfected, and ready for the next patient. Patient records, radiographs, and laboratory results are in place. So before you even call the patient back, you should have the patient's record in the room. If not, you'll pick it up when you go to call the patient. You'll pick it up out of the bin. The x-rays should be up on the computer already or on a view box if your office does traditional film x-rays, and laboratory results in place, which means like if you're having what the procedure is called a seat, which is the permanent cementation of a permanent restoration, like a crown or a bridge or etc., then you should make sure that you have that case in before you even call the patient back. Sterile preset tray and other supplies in place, so you could already have your tray set up before the patient comes in. Dental chair position to seat the patient, so in an upright position. Additional equipment moved out of the way for the patient and the dental team. So greeting and seating the patient. Pleasantly greet the patient by name in the reception area. Escort the patient to the treatment area. Place the patient's personal items in a safe place out of the way of the procedure. Sometimes the operatories will have hooks where the patients can hang up their jacket or their hat or their purses. Initiate conversation with the patient. How was your day? How's the weather? Oh, remember last time this happened, or today we're going to be doing this, etc. Ask whether the patient has any questions about the treatment for the day that you might be able to answer. So you can talk to them about how long is the procedure going to take, what's going to happen after the procedure, anything that they should be taking care of or not doing after the procedure, when they need to come back, and if they need to have any type of payment that day is also important before starting anything. Team dentistry. Components of work simplification. Decreased number of instruments. Ergonomically correct equipment. Sequencing of instruments on the tray by their use. So like we spoke about before for chapter 34, you putting the instruments on the tray in order of use. Correct positioning of the patient, the dentist, and the assistant to minimize fatigue. The use of appropriate moisture control techniques. Moisture control means like using cotton rolls and gauze and stuff like that. The transfer of instruments and dental materials as necessary, and the use of the least possible amount of motion. The performance of expanded functions by the assistant. Principles of team positioning. The dentist and the dental assistant should develop positioning habits that allow access to and visualization of all areas of the oral cavity. Whenever the dentist and the assistant must stretch to reach for an instrument or gain access to an area of the mouth, stress is placed on the body. And that is correct. Stress is placed on the waist, on the shoulders, on the neck. Accumulated strain contributes to lower back pain, circulatory problems, and muscle aches and pains. And I can attest to that. The concept of four-handed dentistry. Positioning the patient. Once the patient has been escorted to the treatment area and seated, he or she is lowered to the supine position, asked to slide up in the chair until the top of the head is even with the top of the headrest. And again, if the patient is even tall enough for their head to reach the headrest, asked to turn his or her head to the right or the left to allow easier access to a specific area of the mouth. So depending on where you're working, you will ask the patient to turn their head either to the right or to the left. The operator makes final adjustments to the chair to establish proper working distance, and the correct distance should be approximately 12 to 14 inches. And again, this is operator preference. Positioning the operator. They're seated as far back as possible, usually with their back against the back of the chair, thighs parallel to the floor or knees slightly lower than the hips, and feet flat on the floor. The backrest of the chair positioned to support the lower portion or small of the back. The operator's forearms bent at the elbow and parallel to the floor. So this would be a correctly seated operator, or the dentist, or you, because when you do your expanded functions, you will be sitting in the operator chair. Positioning the dental assistant. Seated well back on the stool, feet on the base or foot ring of the stool, positioned as close as possible to the dental chair, legs parallel to the patient's chair, and eye level 4 to 6 inches above the eye level of the operator. So this is a correctly seated dental assistant. Like I said before, you kind of have to be careful with this. You can't be too high up, because if you can't reach the floor, you won't be able to move the chair if you have to reach for something out of the drawer, or if you have to slide the chair over, or etc. Okay, and also you have to have a good balance, because if you lean on this, on the abdominal rest, the chair can actually tip over. Motion economy. So Class 1 is movement of the fingers only. Class 2 is movement of fingers and wrist. Class 3 is movement of fingers, wrist, and elbow. And Class 4 is the use of the entire arm and shoulder. And Class 5 are the use of the entire upper torso. So Class 4 and Class 5 are actually the two that you would have to avoid strain on your muscles and on your back. Now we're going to talk about the operating zones. So a basic concept required for efficient, comfortable practice of team dentistry. And there's 4 zones. There's the operator zone, which is the zone of the dentist, the transfer zone, which is the zone where you transfer instruments to and from between the dentist and the dental assistant, the assistant zone, and then the static zone. So for a right-handed dentist, the operator zone is between 7 and 12 o'clock. The transfer zone, which is where you transfer instruments, is between 4 and 7 o'clock. The assistant zone is only this little zone right here, is between 2 and 4. And then the static zone is between 12 and 2. And the static zone is usually for anything that's behind the patient's chair. Like let's say the computer's here or the high speed hand pieces are back here. If your tray is back here, like on the counter, or if you have some of your mixing materials here, that would be on the static zone. For a left-handed operator, the operator zone would be between 12 and 5. The transfer zone would be between 5 and 8. The assistant zone would be between 8 and 10, and the static zone would be between 10 and 12. So instrument transfer, an ergonomically sound way to practice dentistry using the skills of the dental assistant while including work simplification techniques. The dentist relies on the clinical assistant to have the supplies, instruments, and dental materials ready for transfer into the dentist's hands. It requires coordination, communication, and practice between the dentist and the dental assistant. And yes, it does take coordination. It does take communication. Not really so much communication, because it's going to be nonverbal communication. Because you're going to do these procedures so much with the dentist that you guys won't even have to talk to each other. It's going to be like a second nature type of thing. And of course, it's going to take practice, because you're not going to know the dentist right away. You would have to work with them for some time to actually be able to tell how they want to work, how they want to do things, what kind of instruments they use, what kind of materials they use for certain procedures. And of course, like I said, the dentist relies on the assistant to have the supplies, instruments, and dental materials. It's always the worst when you don't have all the instruments for a certain procedure, or you don't have the correct supplies and you actually have to get up mid procedure to get anything. It's kind of embarrassing, and sometimes doctors get mad. Objectives of efficient instrument transfer. So understand the sequence of procedures and anticipate when the instrument transfer is required. So you always have to be ready, because you'll know after you do a procedure certain times when the doctor will need it. Transfer dental instruments and dental materials with the left hand. Transfer of instruments should be accomplished with a minimum of motion involving only the fingers, wrist, and elbow. Instruments are transferred in their position of use. So it means that the working end has to be transferred like the doctor is going to use it, not on the top. It should be facing the patient's mouth. Instrument is transferred so that the dentist can grasp the instrument for its appropriate use. So you can't hold the instrument too far down, because then the doctor won't be able to grasp the instrument correctly. An instrument being transferred must be positioned firmly in the dentist's hand. So actually what you do is you kind of put like a little bit of pressure or push the dentist's hand a little bit down to kind of let them know that you're transferring the instrument to them. Grasping an instrument. There are 3 basic grasps. There's the pen grasp. The instrument is held in the same manner as the pen, so between your middle finger and your index finger and your thumb. The palm grasp, which the instrument is held securely in the palm of the hand. Palm-thumb grasp, which the instrument is held in the palm of the hand and the thumb is used to stabilize and guide the instrument. Okay, pen grasp, palm grasp, and palm grasp you'll use for transferring forceps, most for ortho or extractions, etc., or for a dental dam, and then palm thumb. Transfer technique. Dental assistant uses a specific single-handed technique for efficiency. Applies to hand instruments, dental handpieces, and air water syringe. So single hand means that you're only going to use one single hand to pass these instruments to the doctor. Variations in instrument transfer. The mirror and the explorer are actually using 2 hands to transfer these, because you're transferring the mirror with one hand and the explorer with the other hand. The same thing for cotton pliers. So cotton pliers, you actually transfer them with the working end towards your palm. Hand pieces also, and instruments with hinges. So instruments with hinges, you won't pass them with the working end towards the doctor. You pass them with the working end towards you. Expanded functions dental assistant. An expanded function refers to a specific intraoral, which means inside of the mouth, procedures or part of a procedure. performed by the clinical dental assistant that have been delegated by the dentist. The advantages are its increased productivity, which means the dentist does not have to be there throughout the whole procedure. He can be seeing other patients. Less stress on the dentist because it's less work for him. More patients can be seen, and increased job satisfaction. And like I said, expanded functions, they are delegated by the dentist. So what you can do in one state doesn't necessarily mean that you can do it in another state. So when you get into the office, you will learn what kind of expanded functions the dentist wants you to do and what you're not allowed to do. Dental supervision. So there's two types of supervision. There's direct supervision, and the dentist must be in the same treatment area as the EFDA. EFDA means the expanded functions dental assistant, for the assistant to perform the function, which means that the doctor is right there. He's in the same room as you. Indirect supervision means that the dentist must be in the dental office area, but not necessarily be present in the same treatment room as the EFDA. So the doctor only needs to be inside the dental office, but he can be in the break room, he can be in his private office, he could be by the front desk, etc. He doesn't have to be directly looking at you. So that's what indirect supervision is. Working as the operator. Operator positioning, developing mirror skills, establish a working position, establish preferred mirror to tooth position. So indirect vision with the mouth mirrors is a little bit tricky. It's something that's going to take practice. So when you're working as the operator, when you're doing your expanded duties and you're sitting in the operator's chair, you're going to have to practice. You're going to have to find your special way of positioning yourself, or your special way of sitting or doing things that are comfortable for you, that won't put any fatigue on your back or on your neck. And the same thing with the mouth mirror. Is you just have to find kind of like a balance of how you want to use it, the position that you want to put it in, how you want to hold it, the distance between the tooth and the mirror, etc. Using a fulcrum, okay, and they'll talk about the fulcrum in a little bit. Understanding dental anatomy, understanding cavity preparations, adapting instrumentation, applying dental materials, and evaluation of expanded functions. The operator positioning and developing mirror skills. Operator positioning, follow all the guidelines and avoid curving the spine and slumping. It's very difficult not to slump or curve your spine when you're working as the operator, or even when you're working as a dental assistant. But try to do that, because in the long run, you will have back issues if you do that. Try to always keep your back straight. Mirror skills, maintain posture, reduce eye strain, and complete specific functions. Position yourself to gain a straight-on visual effect. Mirror must be kept parallel to the working surface. This is what we were talking about, using a fulcrum. So a fulcrum is a finger rest that stabilizes the hand. So right here, the dentist or the assistant is using the lateral incisors and the canine as the fulcrum to work on this tooth, on tooth number 19. And there's other times also that you use fulcrums, like when you're painting your nails, you use a fulcrum, because you just don't paint your nails with the hand up in the air. You're using something, you're resting your pinky finger somewhere to stabilize your hand. Sometimes you use a fulcrum to like shave your legs, like you use like the side of the bathtub or where the soap goes, or etc. You rest your leg there to keep your balance. So that's what a fulcrum is. Understanding dental anatomy and cavity preparations. The knowledge of dental anatomy must be attained if you are to gain an understanding of a dental procedure and a delegated function. To know where to place a dental material and how to apply a matrix band and wedge. And you'll learn what a matrix band and a wedge is further down. It is important for the assistant to understand specific cavity terms and classifications. And we already spoke about classifications of cavities. Adapting instrumentation. You must be able to adapt the working end of the instrument to the tooth surface, and then to go one step further by correctly moving the instrument. So by moving the hand, wrist, and forearm as a single unit for enhanced strength, and by moving the fingers back and forth in a more confined or precise area. So when adapting instrumentation, when they talk about this. It's kind of iffy because sometimes there's certain things that you're not going to be allowed to do in the patient's mouth. Only the doctor will be able to do certain type of things. So they will delegate what you can and cannot do. Applying dental material. So when you take on the function of placing a dental material into the mouth or cavity preparation, you also need to know the application process. So each dental material is unique in how it is used and where it is placed in the mouth. And you will learn dental materials also further down. If it's a material that has different layers or different steps to the procedure, then you need to learn what the process is, what step goes first, what goes second, what goes third, because if you do it incorrectly, then the restoration might fail, or you're not going to get the correct goal across. Evaluation of expanded functions. You are accountable for your skills. You must attain the knowledge and skill needed for an expanded function through mastery of course material and also by talking with the dentist with whom you practice. So basically what this means is, do not try to go into the office and do something that you have never done before or something that you are not sure of, because you're accountable for your skills. And if you do something wrong and the patient or you get hurt, then the dentist is going to be held accountable for you. So that's what that means.